This is a good time since as we're getting started. The icebreaker today is what was your proudest accomplishments in 2024? I'll model and go first. Two things I was able to achieve. I finally, after years of putting it off, I actually got my project management professional certification early this spring. So I started looking into it pre-pandemic. The world blew up, had to restudy after that, and finally just bit the bullet and sat down and took it. So that was a great accomplishment for me. Anybody else? Personal or professional?
I can go next for those who I haven't met yet. My name is Taylor Palmer, and I'm with the Prince George's County Health Department, and I help manage our local health improvement coalition. So we have our health equity work group, and then we also have three other work groups. So if anyone is interested in any of the work that we're doing in behavioral health, our community care coordination team, or our healthy eating active living group, I'll use this as a promotional opportunity to promote our other work groups as well. And my proudest accomplishments this year personally, I am a big reader and I always try to up the number of books I read each year. So this year so far, I've read 60 books and hoping to get a few more accomplished, but I'm proud of it because it shows that I have some work-life balance and that's how I maintain it. And we'll see if it maintains in the new year.
Wow, that's awesome, Taylor. I need to get back to that stage. I used to
So,
be an avid, voracious reader like that um,
yes.
before college and grad school. I stopped reading for fun a lot after that because I was so over it. But I'm getting back into it. Haven't gotten up to 60 books a year. That's awesome.
Absolutely.
Okay.
Well, I
Mhm.
guess I'll go next. I am Sharon Gibbs Cooper with the University of Maryland Institute for Governmental Service and Research. And I guess one of my things that I wanted to highlight for this year was serving on this committee and being a part of effecting change within the county. And I thank each and every one of you for the opportunity to do so. Don't be shy.
I
Come
guess I'll
on.
go as also new. So Rodrigo Stein with La Clínica del Pueblo. I guess my proudest of keep it in the professional realm. We were able to complete a community needs assessment early this year. With over 77 participants using a lot of participatory methods, which
Awesome.
took a while
Congratulations.
to do the analysis and conversations, but it was definitely worth it. So yes, I think that was the process.
Great. Awesome. Anybody else brave enough to and welcome Rodrigo? Anybody else brave enough to share personal or professional?
I will next. I very proud of today. I finished one curriculum that I was developed since January with all educational materials about familias activas in one program here at the University of Maryland in School of Public Health with family consumer science. And then today I completely and give to the director and was with all the material in English and Spanish, all the recipes, healthy recipes, physical activity, um, and adapted all those curriculum. Yeah, and accomplished. Yeah, I started in January and finished today. I'm so happy for that.
Oh,
Wonderful.
wow. So all years, taking you all year, and just must be nice to be able to hand something over at the end of the year, and hopefully you get to take a break.
Yeah, because first of all, I need to set up in Spanish and readapt and edit and all and collect many different um, things about in the field of nutrition and also in physical activity. And then after all, I need to translate all those material for 8 sessions. It's a lot,
Yes, it
but I
is.
finished.
Congratulations. That's wonderful. And thank you for all the work that you do.
Yeah, for the families. We are working on that. Yeah, but now I'm working here with Dr. Bauer. That is another field, and I'm so happy to be here um, in a new role and learning from all of you. Really, I love to be with you every single time in the meeting. And this county is so beautiful. I love it. This county. Yeah, yeah. Thank you for having me.
Thank you for being here.
All right. Any other last minute
I can
people want to share what your proudest accomplishment was in 2024?
I can go. Hi, can everyone hear me?
Mhm.
Yes. Okay. My name is Asohe. I'm a student at the University of Maryland, College Park, and my proudest accomplishment in 2024 was getting into the BSMPH program. It's something I've been working towards since I became a student at UMD, and to get the acceptance letter, and then like I just finished my first semester, so that was really.
Congratulations.
Congratulations.
Thank you.
All right. Well, those are some great accomplishments. We should all be proud of ourselves. Hopefully, 2025 has just as many great things ahead for us. But so we did welcome and introductions. Today, we're going to spend some time um, learning from and meeting the Prince George's County Health Department's Chief of Health Policy and Innovation. I believe you've been at our meetings before, but we'll introduce you shortly and give you a spotlight on our Chief of Health Policy and Innovation. And then this is going to be an abbreviated meeting. There are kind of a couple of things that we do want to remind folks about, and then do some community announcements at the end. And then it's adjourned. And so just as a reminder, this is our vision. We want a Prince George's County that is a place where everyone has equitable access to achieve their full health and wellness potential, regardless of race, color, religion, country of origin, immigration status, class, age, disability, sexual orientation, gender identity, or health literacy skills. And this is what I mentioned. So we are so happy that the county has a new chief of health policy and innovation. I know, Stephanie, you've joined in the past, but this is really an opportunity for us to learn a bit more about Stephanie, her vision, and how we can partner potentially. Um, just before joining the health department, Stephanie worked in various capacities in the Maryland Department of Health, bringing over a decade of public health experience, working with multiple agencies, community partners. She has served as the deputy director of the Maryland Office of Minority Health, and more recently, the Director of Policy and Planning for the Behavioral Health Administration. Ms. Little has led strategic planning for the Behavioral Health Administration and system level programmatic transformation. And notably, she's had over 10 years of direct care experience working as a medical social worker, where she's implemented programs, advised on policy, and advocated for the needs of the most underserved and vulnerable populations. Mrs. Little holds a bachelor's of psychology and a master's of social work from Norfolk State University and is a licensed certified social worker, clinical through the Maryland Board of Social Work Examiners, and is currently pursuing her doctorate in public health from Morgan State University. And thank you. Welcome.
Thank you so much. Just happy to be here. As you stated, I have been here listening and really just excited to be a part of all of the great work you do. I'll be remiss not to acknowledge Taylor and all of her greatness and inviting me to formally come here. I, I always get a little remiss when people read like my bio or my bio adjacent work because it's, I don't know if that really matters in the world that we do. Like the work is really what's most important. And health equity is something that is near and dear to the work that we do. As my bio did state, I have worked in the Office of Minority Health, but I've also done work with Ryan White. I've done work a lot of closely alignment with Medicaid. I was a part of the implementation process for the Behavioral Health Administrative Services Organization, or the ASO. So working with the most vulnerable populations, really helping advocate and set policies for the most vulnerable, underserved, and underrepresented has been something that has been my life's work. More importantly, I'm here at the county because I am a county product. I was born and raised here in the county, well, born in the district as most of us are, and then lived in the county my entire life. I'm a Prince George's County School student product. I went away. I went to college and came back. And so I give you that context to really make you understand how much I really do am gainfully invested in what's happening in our community, not only because of where I work, but because this is where my early beginnings began. And so it's really an honor to come back and work for the county that gave me so much. And so I do find it to be a really great opportunity for me to serve in this capacity, to give back and to really uplift voices for those who are marginalized, for those who are underrepresented, and for those who may not always make it to the table, spaces, and stages that some of you all have done or accomplished the things we've done, that our voices are there to amplify other voices that can be considered voiceless in times of marginalization and in times of, high political climates such as we might find ourselves in. So my office is a mighty office of one. So I am one office of one. But my job is to work in the office of the health officer. And so overarchingly, I'm working on policies across the department. And it's the bridge the gap between what's happening federally, what's happening statewide, and then what are we doing locally. And so it's my opportunity and pleasure to kind of synthesize kind of where's the landscape going. And as you can imagine, it's a very interesting time that we are standing in. Also, we're underpinning that we're on the heels of our legislative session, which begins in January. If you're not familiar, our legislative session begins the second week of January, roughly around January 8th or 9th. I always lose a day. And it goes furiously for 90 days. And then by the second week of April, we have Sine Die, which is basically the end of session. And then we all start to implement all the great work that our legislators at the state level do. Our job at the county is to kind of bring forth anything that is happening that may impact us, either positively or have some concern, for us to make sure that we are highlighting that for our county exec, highlighting that for our health officer, but highlighting that for the public as a whole. So I'll be furiously working across the entire health department, bringing forth those things to do. But ongoingly, we work really closely with the Board of Health, bringing forth conversations, bringing forth policies, and bringing forth programs and projects we want to do. So as I do stalk this work group very closely, I know one of the initiatives that you all are very excited about doing is Health in All Policies. That is a strong initiative that the county council has been speaking of. There's also been legislation that was put forth back in 2020, but we did have a whole global pandemic going on at the time, which took greater precedent than trying to initiate this work. Health in All Policies is something that I'm very familiar with in my previous tenure. I sat on the state advisory board for Health in All Policies, helped construct the paper and the legislative response to that. So there has been a lot of conversations about that. And the health, Dr. Levy, our health officer, has been very poignant. It's kind of one of the first marching orders I got when I assumed this role, and noted that he wanted us to focus on that. We're definitely in the throes and in the midst of our strategic plan. I know that Taylor has probably informed you all about that process. And so a part of that is to steady our readiness for that. So I'm always about a lift and shift. And so how are we currently benchmarking ourselves? What is our current stage, and what do we need in order to really poise ourselves ready to do something such as health and health policies? Concertedly, we're also looking at how we are moving towards the model of 3.0. If you're Public Health 3.0. So if you're familiar with the guidance that's come out of Health and Human Services at the federal level, that they are, imploring all health departments, especially local health departments, to be shifting from being the doer model to being the convener, the champion, and the oversight or monitoring position. And I think that, Prince George's County has been doing that work very slowly and very intentfully, but really trying to see where we are. And I think all of that overpins our ability to really seek FAB accreditation or public health accreditation, which really would have us stand out. We would not be the only county that's done that. There have been other local ones, but I think it would say a lot because we are a suburban county. We are a minority-driven county. We are a county that is very unique to the state of Maryland. And I think to have us have that seal of excellence that we already do, and having this work group help us move in that part, will be really important. And I bring all this up to you all because health equity is in the crux of all of that. So you can't talk about health and health policies without dealing with health equity. You can't talk about moving to FAB accreditation without having that. One of the biggest components is health equity. And when I served in the Office of Minority Health, I was advising on that work when we were starting to look at that as a health department at the state level. And then you can't talk about moving to a 3.0 model without really looking at the social determinants of health and subsequently health equity, and really how do you bridge the gap for all of that. So I've said a lot to say that I probably will, I will be here. I am here to serve. I'm here to put me to work. I'm here to aid and be a part of anything that you all feel is going to help advance the work that you want to do. But what I believe in and what I love about coalition work and advocacy work is that you all are the voices. You are the ones that have your ears and pulses to the streets. And although I've given you kind of my personal and professional background of why I'm here, I don't presume to know what you're dealing with, both as constituents and as workers and people who live, work, and play here in our county. And then your voices mean more than what I bring to the table. So I'm here in a listening capacity and a learning capacity. Taylor just bragged about how many books she read, and I too have forgone my passive reading for academic reading. But I do feel like I'm always an experiential learner. So I'm here to learn from everyone in this room. Help me to do what you feel is in the best interest to do. And I hope and I implore you all to know that you are the voices for the county. You are the ones that can really make moves and shifts happening. And now more than ever, it's really poised for you all to continue to serve in those voices and those capacities. I'm happy to be the conduit to get you into the rooms to help you write, help us construct whatever we need to do in terms of briefings or anything that we need to get before the council or even the state legislature if necessary. But it's really your voices that we're here to amplify, to here to support, and here to really give way to. And I think you already do that very well, so you don't need me to do it, but I'm happy to be a conduit and to be a champion on your way and on your path to achieve what you all feel the county needs in way of this work group. I have said a lot. I'm here to answer any questions you might have about that. I will say some initiatives that have really come out of our office and some of the things that we're focusing on for 2025 and onward. We're still in fiscal year 25, but going into fiscal year 26. It's health and our policies, it's public health 3.0, really implementing our strategic plan. There is a health assurance bill that has come out, and there's a work group that's being formulated under Councilwoman Bouquet's leadership and in partnership with the health department, with Dr. Levy's partnership and leadership, co-leadership with that. So there will be some things going out. If you're not familiar, health assurance was resources that were given to our federally qualified health centers to help us move the needle of addressing the needs of getting health and services to those who are underinsured or uninsured. And we know that that's a huge gap in our services and very vital. But, you know, the sustainability process of this programming, how do we continue to make it run, and how do we ensure that we get people to the services that they need, is something that we need to bring forth really strong minds to the conversation. So that work group is being formulated really under the leadership of our council, but within support of the health department. Additionally, there's been a lot of data going out around infant mortality rates and how the data has really shown a strong disparity around that for African American women, both in mortality and for our children and infant mortality rates. This is not something that's new to us. There's documented and research data that supports this. But what are we doing as a county to really support our community? So, in partnership with our Family Services Division, we'll be working on pulling together a smaller work group and getting a report out by September of next year to really do that. So I'll be working very closely with Dr. Diane Young regarding that, and we'll see what comes out of that. And we welcome anyone to be a part of that if you have a special interest in that area. And with that, we'll, again, as I already stated, moving towards seeing if we're going to be moved employees for 3.0. And then internally, we're always looking to gain better efficiencies and how we can better support and do that. So I know Taylor's probably shared with you our partner survey. If you have not had a chance to do it, please share your information, because that also helps us work on internal efficiencies and processes, which I'm really integrally a part of. I feel like I've talked way too much, but I wanted to give you all just a overview of where I am and what I've been working on since I've been here since late August. Again, I love the work that you do. I'm always invigorated to come and listen to all the great work you're doing. If you have any questions for me, I'll leave my information in the chat if you want to reach out to me on a one-on-one basis, but I'm here to answer any questions that you have today. Happy to come back as often as I'm allowed to be a part of any discussions. But if I can be a support to you, both in this group or something that you're working on, feel free to reach out. And again, Taylor, thank you for the invitation. Thank you, Ms. Stewart, for allowing me the privilege to speak during this time. And again, I wish you all a happy holidays if you celebrate, and a prosperous new year. And I look forward to working with you all in 2025.
Wow. Ms. Little, thank you so much for sharing such wonderful insights. I see that you are going to be of value to this committee, especially we're, looking at a full spectrum of ideas and concepts, and a lot of what we're going to be doing will be actually beneficial to shaping policies and identifying any gaps. So I would see you definitely as a asset to us, and we will definitely be tugging your ear and your mind and better approaches to be able to effect change and better leverage resources. And just another one question I have: are you also working with local hospitals with your coalitions regarding maternal and child health and reducing morbidities and chronic diseases and so forth? Because
Yeah,
I
I
do.
think I'm so sorry. Go ahead, Ms. Cooper. I'm
No,
sorry.
please. No, please
No,
continue.
so, and is it Ms. Cooper or Dr. Cooper? Because I want to be formidable appropriate.
Dr. Cooper.
Sorry, Dr. Cooper. I presumed it would be, but I just wanted to make sure I was right. So my apologies, Dr. Cooper. So
No worries.
so yes, I think that that's a really vital part of this work. A lot of the work that we're doing, I'll use another area that we've been really keenly focused on, which is the Dyer Center, which is doing our crisis services in the south part of the county. One of the things we're trying to do is really build a coalition to really support and anchor that work of bridging between community-based services and making sure that there is a seamless entry point and exit point from our hospital services. And I think that having our hospitals to be on that coalition and be a part of that discussion is going to be vitally important. I also, as I'm thinking through this, and this is just me outside thinking, and you'll learn that about me, I think out loud a lot, is that I also want to see a contextured group that we have people in the county that work in maternal and child health, prenatal health from a mental health perspective. Where are they in the conversation? When we're talking about how do we address the whole lifespan of the whole continuum of people that are going through maternal and child health. So of course we want people to have their children and have their babies and be safe. But what about postpartum? And what about how that impacts people's life cycle, and how and that's the earliest stages for the child's experience. If a mother's going through postpartum, then how are we supporting them from a behavioral health contexture? What if that child was born substance using, or what if that mother is substance using? What are we doing to support them comprehensively? So while I think the hospitals are a vital point, I also think community-based providers are a vital part of that as well. And where are we all working together to make sure that these children and these mothers are not falling through the cracks? And even if they do suffer an unfortunate of infant mortality in certain instances, how are we then supporting the mother through that grieving process to make sure that they have the supports and the needs? So I'm looking at it as like a full life spectrum. And I know that I'm isolated in that. And actually, we meet with FQACs every other week. And I know that Sharon Zielinski's on the call, and that the state is already engaging in integrated maternal health and how we're moving forward and thinking about that. So I want to ensure that the county is standing in alignment with where we're going. I want to ensure that the county is really positioning themselves to be on the forefront of this issue. Hi, Sharon. I want to make sure that they are that we are really speaking the language and our voices are being heard, because it's our issue. It is our issue that impacts the people that we know. And I do not want someone to speak for us. I want our researchers to be at the table, our clinicians to be at the table, and I want to make sure that we are all giving voice to it so that we are being effective and being effectual in the change that we want to see coming. So I think, to your point, Dr. Cooper, we will make sure we have those people there. But if there's anyone that you think are poignantly that should be a part of that, please feel free to bring forth those names. We would love to engage with them, whether it's on this work group or just ongoing work that we're thinking about as the health department. Because I think we want to learn from as many people that are doing this work in the field that are experts, but especially experts dealing with this particular population as we possibly can. So thank you.
Thank you.
And I'll jump in for a really quick question. I have had the honor and privilege of working with Stephanie since her joining the health department in August. But Stephanie, just curious for you, you mentioned that we're going to be entering that policy season coming up. Are there any resources that this work group should key in on to stay informed during policy season? I know hopefully we will have your voice at the table as we move forward in the year, but curious if there are ways that we can stay informed as policies being introduced, as it's moving through the process, and how we can have those discussions as a work group and how we could possibly fit into that ecosystem.
Yeah. So so the bills drop pretty fast during session. So it's a really roaring type of time. But as I think how the county works, I'm trying to turn off my state brain and turn on my my new county brain. The way I think it happens is the intergovernment agency for the county will send me the bills. What I can do, Taylor, is as those surface, is to share them with you, and you can share them with the group that I think will be um, specifically of interest to this group. What I can also do is share with you all, because of COVID, there were some good things that did come out of that. A lot of the hearings are now held. They're always open to the public. You can always sign up to testify. I'll get you all that information and how that process goes once that's released. If there's something that it may not be just this particular related, but as a citizen, you have a right to testify and witness on anything that you find to be very important to you or your organization. But I would also say, like a big area for us would be like the HGO hearings, where the health department goes and they discuss the budgets. I encourage you to listen to those. If you have copious time, you can make it to Annapolis, make it. But if not, at least they hold them on YouTube, and then they do keep them as they archive them as well. So you can kind of see what happens. A lot of that is where a lot of the programmatic things happen. And I can even come back at a later time to let you know kind of how that whole process runs about. But really, the department itself has to come and be responsive to what the OLA, or the Office of Legislative Affairs, comes, and they do an assessment of an organization. They will say where they feel the needs are. I think it's been publicly known that there's going to be a pretty strenuous and tenuous fiscal budgetary year. So there's going to be a lot of scrutiny regarding, programmatic work, what the programs at the state level are doing. And that has, direct implications to us as a local county in terms of what fundings we will be receiving, how much the state will be able to allocate resources across the board. And so that will happen. But HGO really looks at, that's where the health department's crux of work happens. But if you are working with DHS or Department of Human Services or DSS, Department of Social Services, they also have their own hearings, their own meetings, their own things. The Department of Education does, Department of Higher Ed does. Everybody kind of takes their turn at the bat. And so I can definitely share the bills as I receive them. As this is my first time around the bin, I'm going to learn too. So as I'm learning, I'll share what I know, and if I fumble, we'll fumble together. But what I will also do is make sure that we can do that. And then what I would love to do is, once the session is over, is to come back and do kind of a summarization of the session. And then what that would help us do is start thinking proactively. If there are things that we want to introduce, if there are proposals or bills that we want to put forth, then we probably will want to start doing that towards the end of session, thinking about it for the new year, thinking like, so over the summer, because it would have to go through, as you know, Taylor, a lot of approval channels. So the health officer would have to weigh in, our county exec office would have to weigh in, if we want to, and then we have to send it up to the health department, the state health department, if we wanted to put forth a departmental of any kind of source. Not to say we can't, it's just we have to be proactive, right? And so I think going through this session, seeing where the legislators' heads are, and then thinking about how we want to poise and position ourselves would be our kind of next steps. And we can start thinking about that as early as the end of session and really formulating ideas and crystallizing them by summer to get them up the natural channel, so that by this time next year, we're really poised and ready. Unfortunately, I started late, so we're going to go through it together and we'll learn together, but at least it'll give us all the shared learning we need to really position ourselves for the following year.
Thank you, Stephanie. Looking forward to working alongside you. And I see Judy's question here in the chat. Stephanie, are you familiar with the Maryland Prenatal Quality Committee?
I have heard of it. I have not been a part of it, Judy, but if there is anyone you can connect me to, because I think it will be a good opportunity to leverage and make sure that we know where they stand. Because for me, it's about, the report is going to the council. The council really wants to know comprehensively what's happening. And so if there's a prenatal quality review, I want to know kind of where their tenants are, where they're standing. And so if you do have a point of contact, I'm happy to reach out to them and get in familiar and kind of assign or enlist where they're standing and try to unfold that into the work we're trying to do. I don't ever believe in recreate. I'm sorry, go ahead.
No, absolutely. I will make sure that I give that to you. There's a website that you can also look at. The
Okay.
organization that I work with, Health Quality Innovators, we're a consulting group. My colleague Katie, she's the one who's actually running that committee for the state, although Ben is very involved, and I've actually sat on the committee for a couple of years too myself. So I'm happy to connect you with them, particularly in listening to what you're talking about. A lot of their work has started with working with the hospitals in the state of Maryland, and understanding where they're at with things, although they are evolving to look at working with FQs across the state, and some are more engaged than others. And and then but they're also doing a substance abuse component of it, but you'll be able to see all of that on the website. So what I'll do here for you guys, and so everybody can see it, I will put the website in the chat, but Ms. Little, I will make sure that you and Katie is who I'm going to introduce you to. Okay,
Perfect.
Thank you.
Thank you so much.
Any additional questions or comments for Stephanie?
I put my email in the chat, so if you think of anything at any time, just feel free to reach out.
Great. Thank you so very much. Going to reshare my screen, but just putting here in the chat our last discussion point of today's meeting. So really quick, just want to bring us back to our outstanding discussion and our completion goal for the year. So we've been working hard to accomplish this intermediary step of the Health Equity Champions curriculum. So folks have worked very hard to identify a bunch of resources, vocabulary that is essential to this health equity resource inventory. So I know we have a few new folks on the call today, so just want to give really quick context as to the work of the work group. So the current ask is the resource list here is in draft form. So I put a link in the chat there. You all are able to go in, click some links, see how it's all looking, take a look at the content, take a look at the accessibility. And if you all have any feedback, I also put a link in there for a Google Doc that you can submit feedback to. And of course, feel free to reach out to me via email if you'd like to have more of a one-on-one discussion and take a deeper dive at the resource inventory. But essentially what this resource is doing, I'm so glad we were able to have Stephanie today because it is a wonderful precursor as to the purpose of the resource inventory. So a few years back, as folks were taking a look at all of the health equity resources that were out there, we noticed that there was a shortage of resources that were Prince George's County specific. So we really wanted something that could belong to the community and have Prince George's County represented throughout the resource. And so this is really a true testament of that commitment to a Prince George's County based resource that is all of your thinking, that is all of the importance that you all have put on these topics. So the resource inventory, it has 3 modules. So we do an introduction to health equity. That is a really good level set session. I want to give a special shout out to Dr. Powell, who was really instrumental in giving us some ideas for definitions to call out there in this level set. So you'll see we have a wide array of some definitions here, again, to level set and make sure that we are meeting folks where they're at in their health equity journey. We don't want to assume that folks know these topics. So giving a really quick overview as well as resources to take a deeper dive in these terms and take a deeper look at how they intersect with other health equity terminology. Down here, you'll see in each module, it's broken up. We have the resource library. And so these are some specific articles, specific interactions, specific pieces to Prince George's County. Again, really want to emphasize that this is a very specific county level resource. So folks can go in here and you can click it and it will take you to varying resources. Some are at the national level, but again, you'll be able to take a look and see like our community health needs assessment. You'll be able to take a look at our very county specific topics and resources that folks can take a look at to read more about advocating for health and all policy, but first taking a look at the groundwork of health equity and what's happening at the county thus far. Then we move into, before I do that, Rodrigo, I see your hand raised.
Sorry, it was by mistake.
No worries. Taking us into module 2, similar format. So we start with our health literacy vocabulary. A special shout out to Marlene's team over at the Horowitz Center for Health Literacy, who were huge advocates for this section and the content here. So you'll see different terms that really help to empower community members to advocate towards organizational health literacy, something that the work group had discussed in creating this resource inventory, that for too long, the impetus has always been on the individual to advocate for personal or individual level health literacy. But with this, we hope that community members can see that they can advocate for organizations to maintain health literacy practices and to think outside the box, to take traditional healthcare and really transform it in a way that's easy to understand and really meets people where they are at in terms of their literacy and their cultural needs as well. So you'll see here, again, we have some vocabulary, we have some additional resources that folks can take a look at, very specific Prince George's County initiatives. Wanted to highlight the great resources that have come out of the Center for Health Literacy there at the University of Maryland, and again, direct folks to additional resources. Lastly, module number 3, this is really circling back to the purpose of this resource inventory to empower community members to be able to advocate to local leadership on topics of health equity, of health and all policies. As Stephanie mentioned, health equity is at the center of many things, of all things really, including health and all policies especially. So we wanted to be sure that we link folks to these resources here as they are going through the resource inventory that'll take them back to different ways to engage elected officials, that there are templates here. They can find their local leadership. They can look it up by zip code. Again, wanted to make sure that there were some specific Prince George's County resources sprinkled in here so folks can log in and take a look at council recordings. And you'll see here we have a few documents. We went over the RAND report. We went over Prince George's Plan 2035 here. We went through this is the policy for health and all policies that Stephanie alluded to earlier, so folks can take a deeper look at all of that good stuff. So in short, again, the ask here, if folks can submit your feedback before the end of the year, we would greatly appreciate it. Feel free, again, if you have any content suggestions. As Stephanie mentioned a few moments ago, it may be good to also include some time pertinent options. So as we begin policy season, if there's a way that community members can also stay informed in policy, we can add those resources along the way and hopefully make this a growing list that continues to evolve, but at its core informs and empowers community members. So I will go ahead and stop there, but does anyone have any questions or any reactions? Sharon, I see your hand.
Yes, I just had a question. We had talked at one point about some sort of a dissemination plan because the website is actually really, really beautiful and so full of stuff, good stuff. But I don't know that anybody would wander their way to it. So I don't know if there's some way to disseminate that it exists and to keep reminding people, that it's there. And then if we have the ability, I'm sure we probably do, to track and see how many hits and where the hits are going to and originating from, that would be really great.
Yes, we will have access to that information, so we'll be able to see what web pages are getting the most visits, where folks are spending most of their time. We'll be able to see general location of where folks are logging in from to see if they are Maryland users or coming at us from another part of the country. And then as for getting more visibility to the website, I know Ray is discussing with our communications department to see if we can do a shout out on the health department's webpage, and taking a look at some of our partner pages as well to see where we can include the link and get this information out to folks. But otherwise, we will be tracking it. The work group discussed tracking it every 6 months, or every quarter. So we'll be taking a look at those clicks. We'll be able to take a look at all that information and hopefully use all of that to then inform a larger curriculum plan, as you all had originally set out to accomplish.
Thank you.
Thank you, Sharon. Rodrigo?
Yeah, I guess with the comments that Sharon brought earlier, and the final comment leads sort of to my question. Is there any future plans of creating some sort of curriculum or accreditation to incentivize the visit of this page? Specifically, I'm thinking it would be very valuable for promotores, community health workers, to get additional accreditation for engaging with the content.
So, I mean, my comment was going to be sort of related to what you were saying, Rodrigo. So for those who may be newer to the to the work group. So this resource list was really like a preamble or the first step towards a larger curriculum. So that would be for our Health Equity Champions program. And that Health Equity Champions program, the intent is for something more dynamic, for interactive, where there's more. I think this was a first step before we got to the point where we're deciding, well, how is it going to be facilitated? Is it going to be something that's self-paced? Is it going to be live? So those questions we still haven't addressed. So I only have a portion of the answer to your question. In terms of, I don't think we've talked about certification or incentivizing people, but I think that's what you're bringing up is a great discussion that we can take up in 2025 when we talk about the next steps of the step after this resource list, which again, in my mind, from what I understand, was really supposed to be first step, and then we move on to a larger curriculum with that's more dynamic. Um, so hopefully that kind of answers your question.
Yeah,
And
no,
I
yeah,
think
yeah. That's
like,
perfect.
and I think we should take up what you mentioned as a recommendation for incentivizing people to participate and
Even if it's just like a printed out, doesn't have to be something
sure.
super.
So, I mean,
Yeah.
and actually what you've said kind of relates to what I was gonna point out. I know on the feedback form, the last question is asking about what information should we collect from the audience. So I mean, in my mind, when we were asking that question, it was really about um and knowing that this is step one, what sort of information might we want to collect from people about their interest in a larger program? Do we want to collect basic, like what kind of program would work for you? What are your interests? This is what we want to do. So should they be logistical questions, content questions? Those are some of the things that are swirl around in my mind. Um, but yeah, I just want to bring that last question to everybody's attention as well. And apologies, my head is hurting, so I'm not really thinking clearly right now.
Thank you, Christine. Just to add to Rodrigo's point about certifications and incentivizing folks to join, I think we can certainly have those conversations, do a quick environmental scan to touch base with those who manage our CHWs, and we can take a look at county council as well and see the materials that they're reviewing when they are onboarded, or certain certifications that they go through, and see if that could inform a larger curriculum, or if we can modify this resource inventory to be more inclusive of some of those areas, some of those gaps, and again, constantly evolve this. But as Christine had mentioned here in the Google form, the last question to collect that information from the audience. So again, Ray Wallace, who maintains the website, she is able to take a look at the clicks and see what resources are being utilized the most, viewed the most. But again, if you all have particular ideas for information, I know we talked about how folks would like to receive a curriculum, if it's viable for them to come in person or if they would prefer a virtual option. We can certainly add a questionnaire at the end of the resource inventory that would ask folks those questions. We can get them connected to the work group, whatever information you all think is important and would be able to best inform the curriculum and some of those objectives that we would hopefully set out to accomplish. And Dr. Powell, I see your hand.
Thank you so much, Taylor, for recognizing me. I'm wondering also, I think someone mentioned how to share this site with other health departments. So I'm just wondering, in the way of dissemination, is there an opportunity to present this at some type of national or I don't know the organization, but I'll make up something, some type of national organization for health departments, so that, even if it's a poster presentation or if it's a podium presentation, but just to share this as a tool that other departments could use, particularly after we get some data around utilization. But it could be one way to just share the product in other counties. Just a thought.
And Sharon, do you
Very
have
true.
a response or another question?
Actually, I have a bit of a response. The Metropolitan Washington Council of Governments has a health officers committee that meets regularly, and it may be that we could share this with a little blurb with the person at COG who staffs that, and they could share it out. And there is also a Human Services Policy Committee that's even much broader, that has a lot of elected officials and stuff, again, locally. Um, it's sort of our region, including Howard and Charles County and a few other counties besides just the immediate metro area. But that's one good way to share the information, let people know it's there, and make it available for other people, health department staff, and others to access.
Yeah, those are great ideas. Thank you. And full transparency. So I think we modeled a lot of this. So Montgomery County also has something very similar, and we modeled this stuff in that. So just want to make sure that we don't say like, oh, we've reinvented the resource list and nobody else in the region has done that. But I think it's always good to share what we're doing. Um, and so I also want to encourage us to, when we're thinking about dissemination, when you're talking about health and all policies, building people's vocabulary and understanding, let's try to get out of our own silos and the health department world, the public health world. This also think about other sectors, people in transportation, maybe corrections. Those are other areas. So I mean, and Sharon, I think I love the idea of sharing it with the Metropolitan Washington Council of Governments, and maybe so we can that can help us get outside of just our health frame, because that in my mind that's the goal of health and all policies to so that others see their role in bettering the health and wellness of our county residents, and so please, when you're considering, like even with your feedback, use that lens. I mean, at least I'm going to use I statements, and that was my vision and my interest. It's not just our public health partners, our typical health department partners. Let's use this as an opportunity to help others, who very much impact the health and wellness of our fellow residents, and see how they have an impact on health. And this is just a way for us to help them build their vocabulary, as well. And I'll step off my soapbox, but that was my vision. And hopefully I mean, and I just also want to ask, is that what others feel is important? 'Cause I think as the group changes, I think it's also we may want to take a temperature check to see, is that really the continued vision? I mean, I'm pulling from way years back when somebody first came up with the Health Equity Champions program, not me, and kind of borrowing on that idea. But times have changed. That was pre-pandemic. Our needs different. But yeah, again, I just encourage us to think not just our typical partners, but maybe our fellow colleagues in other departments, other sectors, and things of that nature.
Any other questions regarding what Christine has been talking about and our direction and in the future? I think we have also, because this is so community focused, we want to also engage the community as well to be able to identify those needs, just to make sure that we are on point as well. I think that's a very critical part of being able to not only identify what's going on, but also being able to address those particular needs and leveraging resources to do so. With that, Taylor, I think we're going to turn it back over to you if there aren't any other questions.
Sounds great. Thank you. Thank you all again for all of your hard work that you've given. This has been a multi-season project, so appreciate you all sticking it out with us to see this end product. And again, this will be a conversation that continues as we start to think about how we want to disseminate this and hopefully get in the hands of as many Prince Georgians and multi-sectors as Christine alluded to. And then also make sure that we're taking the feedback along the way to keep making this the best resource inventory that we can, and one that is representative of where the community is at in their health equity and health and all policies journey, and how we can continue to empower the community. So I am going to switch us back now to our meeting slides. So again, if folks can take a look at that and provide any feedback, again, it doesn't have to be well written out, but if you have a resource that you want to have added, or if you want to put down a few words, feel free to do so. Feel free to email me. If you have any feedback that you want to discuss, if you all can provide that before the end of the year, that would be greatly appreciated, so we can get that over to the web designer and she can make those edits for us all, and then we'll have hopefully a more finalized version going into the new year that we can reflect on our conversation that we've had today and how, again, we get this far reaching in the county. All right, next, transitioning us to our community announcements. So I will share with you all, we have the Prince George's County Health Action Coalition Partner Survey. I will put that link in the chat. We want to hear from you all about the organizations that you represent and the services that you all provide. So if you all can fill out this survey, it asks a few questions specifically about your organization and some of your capacities. We're hoping that we can create a better directory, a coalition directory, so we know where our gaps are in partnership. So again, when we do have successes like the resource inventory and we need to spread it far and wide, we want to make sure that we have representation from all different sectors. We know that public health touches a lot of different topics, a lot of different areas, a lot of sectors. So we want to make sure that we have representation throughout the coalition. So if you all can take a few minutes to complete that survey by January 17th, we would greatly appreciate it. And I will open space for any other community announcements. If any partners have anything they'd like to share. All right. Well, if we haven't echoed it enough, just want to again thank everyone for all of your service throughout this year and throughout the time that you've been with the health equity work group and your careers, what all you have done professionally and personally to advance health equity in Prince George's County. It is making a notable difference, and the only direction we can go from here is up. So let's continue doing great work and accomplishing more all together, utilizing all of the skills and all of the diverse backgrounds that we all bring to this work group. It is a true pleasure to work with you all, and really thankful to have you all here to advance. I know we have a vision here at the health department that we say we want to see all Prince Georgians at their healthiest at every age and every stage. So thank you all for helping to advance that vision. Dr. Cooper, Christine, anything else you would like to add?
No, just thank everyone for all of their due diligence and for their commitment. Taylor, thank you for bringing us all together and getting this coordinated so that we are being impactful and that we continue to be impactful. And I look forward to the upcoming year so that we can really dig deeper, as you said, and go upward and onward and put everyone's skill set to work so that they are feeling that they're belonging and that they can add value to this particular process. So thank you all and have a blessed holiday season.
Thank you so much, everyone. Happy holidays and happy new year. See you back on
In
Thursday, January 15th.
2025. Yes.
Feel better,
Be safe.
Christine.
Thank
Thank you
you.
so much.
Thank
Take
you.
care, everyone.
You're everyone.
Bye-bye.
Bye-bye, everyone.
And hi, sir. So good to see you.
Hi, good to see both of you as well. Happy holidays.
Yes, happy holidays. I hope everything is going well and wishing you and your daughter the happiest of holidays.
Thank you so much. Have a good
Thank
one.
you. Take good care. Thank you.
Thanks, you too. Bye-bye.